We're here with Dr. Brian Bai talking about scoliosis. Dr. Bai, for those with a child who's been newly diagnosed, what can they expect this new journey to look like?
When a child is diagnosed with scoliosis, the child and definitely the parents, it's quite a shock to have this diagnosis. The first thing I would tell the child, and particularly the parents, is that this is a diagnosis that should not be feared. It is something that we will be able to treat and be able to monitor throughout the rest of their growing years of their childhood.
And what is your philosophy of care when it comes to treating this condition?
I would say that my philosophy is to treat the patient hopefully in a non-surgical manner. This is particularly true for curves that are mild. And most of the patients have a mild curvature. For patients that have a larger curve, we do have other treatment options, but most children never require surgery.
So then, what are some of the treatment options provided for scoliosis with Prevea Orthopedics?
So for a mild curve, the only thing that may be required is a clinic visit with x-rays, usually about every 3 to 6 months. For curves that are more progressed, we do have options such as a custom brace to try and help prevent the curve from getting worse. And if there is a child that has a curve that is very significant, we do have surgical options.
And if surgery is needed, what steps do you take to ensure the best possible outcomes?
For a child or teenager that requires surgery, first we have some very specific x-rays that are taken to help us determine where the surgery is needed in the spine. If they do require surgery, at the hospital we utilize our pediatric hospitalists. They are our medical doctors that also help the child during the recovery. We also utilize physical and occupational therapists, both in the hospital and potentially on an outpatient basis after the surgery.
For those with a child who's been newly diagnosed or they've had scoliosis for a while, this might be a really difficult journey for them. What are your words of encouragement?
I would encourage the parents to know that the diagnosis of scoliosis is not a lifelong sentence of back pain or back troubles. I would also convey that to the child, but they typically do not have such a long-term outlook on it. For children that require bracing, I try and encourage them that there is a light at the end of the tunnel, because wearing a brace every day is very difficult, especially if you're a teenager. And for children or teenagers that are undergoing surgery, I just encourage them to let them know that things will be okay, and that we'll do the best to give them a good result.
For a complete list of Prevea orthopedic providers in Wisconsin and for more resources, visit prevea.com/ortho.